Well, hello, everyone. Welcome to the MedVR talk series. We give regular talks on the topic of medical XR. We're being co-broadcast by the American Medical XR Association. At the same time, we're on YouTube. If you're trying to find our website, it's medvr.io. Please come and sign up for future talks. Very excited about this talk about using virtual reality avatar therapy to treat patients with schizophrenia. It is what I find fascinating about it is it's built on prior research and continued research in Denmark at the university. The Khora team of both an XR studio and under the leadership of a clinical psychologist have built the solution for treatment that I think you'll find very, very, very interesting. What I think is important that this talk really emphasizes is that VR is not a headset. VR is not is not Unity or Unreal. It's finding the right features of extended reality to build an application that is that can do things that this is the only way forward. And I think this is one of those really interesting applications. So stay tuned with us. We've got other talks scheduled. Stay in touch with us, and I'd like to get the talk started. There will be a session at the end where the audience can enter their Q&A questions. If you look down on the bottom of your screen, there's a chat with a Q&A under it. Please enter your questions there. And right now, I want to turn things over to our moderator, Omer Liran. He's an MD, an assistant professor of psychiatry and behavioral neurosciences, and he co-directs the virtual medicine group at Cedars-Sinai. He's a domain expert in the field, and we've really focused on having moderators of this skill set, of the same skill set as the speakers. So I'm looking forward to the talk. And Omer, please join us.
Yeah, thank you, Steve. And I'm also very excited for this talk. I'm joined here by Simone Leiboskitz and Dr. Shiraz Farah, who are going to talk to us about how virtual reality avatar therapy can help treat patients with schizophrenia, a topic that is very important to me because I'm a psychiatrist, and I'm also co-director of virtual medicine here at Cedars-Sinai. So as many people know, schizophrenia is a condition that's very difficult to treat. Patients often are wary about opening up to their therapists or going to psychiatric treatment. So having an alternative treatment available in the form of avatar therapy is something that I think is a very clever idea, and I'm really looking forward to hearing more about it. Yeah, so Simone and Dr. Shiraz, why don't you give us the presentation? And a reminder to the audience, leave your questions and we'll get to them after the presentation. Thank you.
Cool. Yeah, thank you so much. And thank you for inviting us. Yeah, I think, my name is Simon, the CEO and co-founder of Khora and Heka. So before we get into the really interesting stuff about avatar therapy and schizophrenia, which I think is really the most interesting part of this talk, I'll just give you a little brief background to how we got to this and the background of Khora. So I started Khora together with my business partner Peter in 2015. We started publishing by publishing Denmark's first VR game, and then we decided that we were going to try to figure out how this kind of almost magical technology could be used to solve problems. Because I don't think anyone really cares about technology. We only really care about what it can do for us and how it can solve problems. So in 2015, we decided that we were going to explore the potential of this technology. And we did that by opening an arcade and a studio in Copenhagen. So over the last 7 years, we've done 400 different VR and AR projects. We're 40 employees now. And we've worked across different industries because I think the potential in mental health is tremendous, but also we've tried to solve problems in other areas like training, pain distraction. We also work a lot with anxiety. We also have work with art. And so we tried to really we were really good at building the technology back in 2015, 16, where the technology was really new. And then we invited regular people to come in to a workshop or just an arcade and try to see what they saw potential. Because if you're looking for creating value and solving problems with technology, you need to find the experts within the different niches that see the potential for the technology. And so back in 2016, one of the leading researchers in Denmark came into our showroom, and Margrethe Nordentoft, and really got us into this track of working with using VR in mental health. We started out working with kids in high-risk group of developing schizophrenia, and then we moved on to a big trial around with 366 patients with anxiety and exposure therapy. And then over time, we started getting into schizophrenia and avatar therapy. So this project started in 2019. And for maybe you can go more into this particular project that started as a project and now is a separate company that we're trying to scale.
Yeah, great. Thank you, Simon, for the introduction. Yeah, just to give you a little overview, I have a few slides, well, more than a few, but just to give you an overview of what we do and why we're using VR with patients with schizophrenia. I'll be presenting the solution. So I'll actually give you a little demo of the avatar and how you can create the avatar. As Simon mentioned, I'll talk about the clinical trial that's currently running here in Denmark, and then we can just have a brief discussion about the future of virtual reality in mental health. As Simon mentioned, Khora also has a sister company called Khora VR, which is responsible for this virtual reality platform that enables the treatment of auditory hallucinations. And that's the main product that I'll be talking to you today about. So why use VR in patients with schizophrenia? So as Omer mentioned in the beginning, patients with schizophrenia often don't have many treatment options out there. And even the treatment options that are out there, 30% of patients will still hear voices despite medical and psychological intervention. So it is time for a new innovative approach for treatment. For many patients, even the side effects from medication puts them off taking their medication, and that exacerbates their symptoms due to these negative side effects. And unfortunately, there's a reduced life expectancy in patients with schizophrenia. We know that their loss of life is at least around 28.5 years under recent statistics. And kind of the saddest statistic is that the suicide rate is over 20 times higher in patients with schizophrenia than the general population. So this is an issue, it's a global issue, and something that needs to have some new innovation within it. Just to give you a little bit of content of what it must be like, what it's like for patients with schizophrenia who hear voices. They can often be derogatory, saying things like you're a waste of space, you're stupid. It could be voices that interfere with treatment. That's, again, makes it difficult for them to adhere to medication. threatening, they can say horrible things. It's usually malevolent voices for many of the patients. There can also be aggressive commands against themselves to either, cut yourself, do bad things, or even aggressive commands against others. So it is something that is very challenging for patients with schizophrenia. But patients can live a good life as well with voices. So I don't want to just present the most negative part, but this is kind of what we're focusing on in terms of the malevolent voices, the mean voices that a lot of patients will hear, that makes it difficult to have a good quality of life. So our solution in VR is that we have created the possibility of patients together with a therapist to create an avatar and have a digital representation, which creates a digital representation of their voice, which is voiced by the therapist. This was something that was developed early on back in 2014 by Julian Leff. He actually started this concept of avatar therapy, but his development of using this kind of voice creation, but the difference was that they did it in 2D, so it was more of like on a laptop version, whereas we've kind of gone one step further and created it in a more immersive environment, so using this virtual reality where patients will wear a headset. So how it works is that the patient works together with the therapist and they create what they believe that their voice looks like. And this is called the face creation module. So and you can see on the right, there's a kind of this toggle system that patients can identify, okay, I think my voice is a female voice, it has long hair, it wears glasses, etc. And then all these different features are able to kind of create a visual representation of what the voice might look like. In addition, we obviously have this voice modulation module where patients can, together with a therapist, also create what the voice sounds like, again, by changing the age, the gender, the pitch, etc., to resemble what they believe that their voice would sound like. And then there's this real-time VR simulation, and this is kind of the beauty of the product, where then once this avatar is created, you can take it into this VR simulation where the therapist becomes this avatar and they can work together with the patient to be able to work together with the voice. So it's sometimes hard to imagine how it is. So I'm hoping these videos work so I can show you how it is to actually create an avatar. So this is kind of what it looks like. This is obviously speeded up. So together with the patient, you kind of go through changing the features of what the patient says that their voice looks like. You can change the skin color, you can change the hairstyle, if there's a beard, if there's facial hair, glasses, etc. So there's lots of different features that are able to change, even face width, the nose, the mouth size. So we've created this kind of very sensitive toggle system that patients can create their unique voice, unique face of what they believe that the avatar would look like. The next feature hopefully shows the voice modulation. Hopefully if it works, if you can hear it. So what the therapist does is record their voice, and using this voice modulation software, we're able to change sort of the pitch and the tone again to resemble how the patient hears their voice. So you can just see all the different kind of components that can change. So you can see that there's even slight changes that you can change to get the sensitivity of the avatar. And this is sort of when the patient puts on the VR goggles and the headset, and this is a clinic scene that the patient is presented with. It's just speeded up, so that's why it's a bit shaky, but you can just see that it starts off on a 2D, and then the patient can, as the more confident the patient gets, they can bring the avatar closer to them, as far away from them as they want. And then this is kind of the communication that they will have with the avatar. It's just shaken because the video is obviously speeded up. And then we also have this kind of relaxation. It's not very relaxing because it's moving so fast right now, but we have this relaxation scene as well, where patients, if they have very high anxiety and they have like a panic button, so they can press this button and go into this safe space. And we also use this after the therapy as well as kind of a debrief for the end of the session. So that's just a quick intro into what the demo, the avatar looks like and how we developed the avatar together with the patient. And obviously we want to test if this works. So there is evidence out there showing that avatar therapy does help reduce frequency and amount of auditory hallucinations in patients. And we here in Denmark have just in the midst of conducting a clinical trial where we have one of the largest clinical trials at the moment running. We are just in terms of recruitment, and the recruitment is about to end at the end of this month, actually. But the way that the randomized control trial works is that the patient is first screened. They have to have had a diagnosis of schizophrenia. And for this trial, we're actually recruiting patients who are the hardest to treat, so the treatment-resistant patients. So they would have had medication, tried psychotherapy, but still experience voices. So that's one of the key inclusion criteria for this trial in particular. Patients are then randomized to either receiving 7 sessions of the VR therapy and treatment as usual, or 7 sessions of supporting counseling and treatment as usual. They're then followed up at 12 weeks and then followed up at 24 weeks as well. If they need more sessions, they have 2 booster sessions as well, because, you know, as you're aware, this is a clinical sample. So a lot of clinical judgment is based as well with this patient group. So sometimes they will need 2 extra booster sessions or to be able to continue with the study. Also, I just want to point out that we make sure a big exclusion criteria, the patient has to be quite well to take part in the study. So one of the exclusion criteria is that there's no suicidal ideation, because of course that's a very high risk in this patient group. And they kind of have to be cognitively aware of what's going on and of course be hearing voices, but still be able to participate in the study. There are many primary, the primary outcome is something called the psychotic symptom rating scale. I won't go into too much detail of all the outcomes that the psychometrics that are being used, but just to give you an insight into kind of how many outcomes and how much data we're going to end up having when we complete the trial. So in addition to measuring frequency and intensity of voices, we are also looking at depression, quality of life, social functioning, and we also have a cyber sickness questionnaire in there as well to kind of look at the impact of patients who are undergoing the VR therapy. And in terms of the virtual reality therapy, again, like I say, it's based on the therapists have developed a therapy manual. There's 3 key phases of the therapy. It's underpinned in a cognitive behavioral and compassion focused therapy. So this means that it is aimed at trying to, for patients to try to learn to control their voices, but also try to work to cope with their voices better. Within the trial, they have the main kind of 3 phases are development and exposure to the avatar, and encouragement of dialogue with the avatar, where the patient practice to reject the avatar's negative commands, and this focus on self-esteem and identity. So the whole purpose is to help change the relationship between the voice and the voice hearer to make it feel less inferior and less motivated and fear to themselves. Normally, in terms of the therapy, the patient is in the avatar session for around 5 to 15 minutes. And the rest of the session is spent on preparing a patient, whether it's a confrontation with the avatar, reflecting on the interactions that they've had with the avatar, and using these kind of cognitive behavioral techniques to reduce the hallucinations associated with the distress. There are 2 publications out there at the moment. The trial is still running, so we don't have any data that we can share with you, unfortunately. But there is 2 papers. The first paper on the left, and if anyone's interested, I'm happy to share references at the end, is kind of a protocol paper and methods paper, which kind of shows you the trial and how it's being run and all the different psychometrics that are being used. And the second paper gives you a few clinical case studies that gives you real insight into how it has worked for some of the patients in the trial. But it is a double-blinded trial at the moment, so we're unable to share any sort of information because we have to wait for the analysis at the end of the year. So this is where we're at with the trial. Like I mentioned, there was a pilot study in early 2020, and I have some data that I can share with that. And I'm going to just present a couple of case studies. But the trial is running up until the end of this year, so we won't have any results up until 2024. What we are doing with Khora and Khora is that we're trying to launch trials outside of Denmark. So that's where we're at the moment. And we've just had CE certification for class 1 of the software as well. So I just wanted to give you a bit of an insight into a case study, just to kind of show. It's, again, like I say, it's very difficult to explain. It's always better to give a real life example to kind of show how we believe that this treatment can really revolutionize the treatment for schizophrenia. I'm just going to read it out because it's very small, so just bear with me. So this is a case of, it's all been anonymized. So Peter is a male in his 50s who was diagnosed with schizophrenia at the age of 21 and has suffered from auditory hallucinations for more than 25 years. Over the years, he's had numerous hospitalizations and been subjected to force and restraint. He has been in treatment with sustained release drugs for several years. The voice he hears is representative of his mother's voice, which he describes as a clamp around his neck when he hears the voice. So just to give you a little breakdown now with the sessions. Session 1, the voices present 80 to 100% of the time, and the avatar is being created together with the therapist. In session 2, the patient sees the avatar in 2D and in 3D far away. The patient experienced pronounced anxiety and had the experience of hearing his mother's voice. He describes the voice as clamping him and persists for several weeks, both day and night, which causes difficulty sleeping. By session 3, the patient considers terminating the VR treatment. However, he comes to his own decision that he wishes to continue, and he chooses not to do the VR in session 3. In session 4 and 5, the patient feels comfortable enough to try the VR again and sees the avatar in 2D and 3D far away. And the avatar at this point is on mute. The patient still experiences anxiety and the sensation of being clamped. By session 6, the avatar says, "I'm your voice," and the patient responds, "Yes, you are." Subsequently, the patient is shocked. By session 7, the patient is in VR and answers the avatar back for the first time. And as soon as he answers the avatar back, he feels this clamp that he describes in the beginning to loosen. Session 8 and 9, the patient answers the avatar back with a firm voice, but still has some anxiety. By session 10 and 11, the therapy consists of focus on self-worth using positive statements from relatives. And by session 12, the patient bids farewell to the voices. The outcome in this patient was that he's currently being phased out of antipsychotic medication and has been given a diagnosis of schizophrenia in complete remission, since he hasn't experienced psychotic symptoms for a period of 6 months. The patient still uses strategies from the challenge trial, which is what the trial is called, if the voices draw closer. He believes he will continue to use the strategies for a long time. So you can see, and this is common in a lot of the cases, that actually after 25 years, this patient actually has stopped hearing voices, and when he does, he now does sometimes if it comes back, he now has the strategies and the confidence to be able to work with these voices. This is just another case. I won't go into too much detail, but I just love the quote because he says, "The avatar therapy saved my life, and had you told me 2 years ago that I would stand here in front of people and talk, I would have called you nuts." This guy is actually one of the advocates for the therapy and does many talks for advocating the challenge trial and avatar therapy of how much it has changed his life, being someone who has experienced, again, voices since he was 6 years old, as he describes. So, and this last case I just want to present, this was actually one of our very early cases that we had. I was hoping to show you a little documentary, but I wasn't sure with the technology, so I kind of just took a little clips out. But this was a patient called Sila, and she did a documentary early on, which documented her journey through the VR therapy. And she quickly had a very positive outcome. And she, in the video, in the film, she says, "It's like my head is completely silent. I have no idea what's going on. I enjoy this calm. And it's absolutely fantastic, but it's also weird." And a lovely part in the documentary was that she shares the voice, and this is a very beautiful part of the study, I believe, is that actually the avatar therapy, you can actually share what the voice and what the voice sounds like and what it looks like with family and caregivers, and that's strongly recommended as part of the therapy. And in the video, she said she's showing her brother and her mum what the voice and the avatar looks like, and you can see that she gets emotional at the end because the brother asks, "Why are you reacting like that?" And she says that, you know, because I'm not the only one that can hear it finally. And I think that it's such a strong component of this therapy where patients stop feeling alone because they're able to share it with their family members, and they're able to finally, and family members are also able to understand, okay, this is what it must be like. This is what it feels like to hear voices, because, you know, we have this concept of what it must be like, but we don't know until you're faced with it. And yeah, so it's a really powerful part of the documentary. And again, if anyone is interested, I can share the short version with you. So what is the future, and what else are we trying to do with the Khora? We're trying to expand this therapy to as many people as possible globally. So of course, it's great that the trial is running in Denmark, but we also want to know if this would work across cultures, across different countries, and that's something that we feel very strongly about. We want to build the clinical evidence. We currently have a few trials that are testing and piloting. We have one in the US, in New York, that is going to be testing on inpatients. So we're really excited to have that trial running and find out some results from that. We also have another trial in Australia that is running more on a remote version, where again, they're using this avatar therapy. And we are in lots of communications with countries here in Europe to try and pilot the study as well. But we're always looking for new sites. So again, if anyone is interested, please feel free to contact us as well. We're also very keen to expand avatar therapy, and it is already being expanded across. In Denmark, we have a pilot study that we're testing on youth mental health, where we're using this in a younger population, which we believe would be a very preventative approach towards people hearing voices. As I mentioned in the beginning, we're using treatment-resistant patients for now, and they've been hearing voices for 25 years. If we can tackle it right at the beginning, you know, we don't want patients to be experiencing voices for 25 years. So looking at youth is obviously a next step that we're very keen to do. We're also keen to look at the difference between inpatient versus outpatient. Also first episode psychosis, looking in different ethnic minority groups as well, I think is something that we're very keen to explore, and also in a different aging, maybe even in the aging population. So these are all different areas that we're still expanding and hope that we can work with in the future. And also across different mental health conditions. So very excitingly, we have just another trial that we're starting in working with eating disorders. And we're looking to expand again the patient pool of outside of schizophrenia, so maybe bipolar patients, personality disorder, and we've even been having talks about maybe applying it to OCD and, you know, more anxiety-based disorders as well. So in conclusion, the clinical experiences and feedback we've received from the patients so far indicate that it is a very beneficial intervention. Of course, I can't say that conclusively yet because we don't have our results, but anecdotally speaking to the therapists and, you know, some of the case studies that we have, it does point in the right direction. We're not sitting here saying this is the cure for voices. And of course, as you saw in the case studies, anxiety for patients is still very high. Patients can still experience voices, but in some cases, voices completely disappear. And that is super exciting. And of course, we have to wait for the results, for the statistical significance, but the clinical significance of just helping a handful of patients to be able to live a normal life again, I think, yeah, it's priceless as well. So yeah, it's about the science, but it's also about the clinical significance, I believe, as well. Therapists and colleagues have expressed hopes that the outcomes will demonstrate a sufficient efficacy of the VR virtual reality treatment. And we're hoping that this is something that can become gold standard and is offered to all patients. So these again are just some quotes, but just to end, to say that this software we believe will revolutionize the treatment for schizophrenia, particularly patients suffering from auditory hallucinations using this virtual reality avatar treatment. So thank you for listening. I'm looking forward to your questions. You can please feel free to add both Simon and I on LinkedIn. You can just scan the codes if you're interested and want to connect and find out more information. I've also got my details at the bottom here if you're interested in running any trials or just having a further conversation about avatar therapy, which we're always very keen to meet with people and discuss more. Okay, thank you.
All right, wow, that was really a great presentation. Thank you for that. Always heartwarming to see the patient responses. I think that's very powerful and something that frankly is missing from reading published articles. We lose that human touch of what the patient actually feels like, what they look like. You know, we saw that patient in tears. That's very powerful.
Yeah. I'm glad I didn't present the video because it always makes me so emotional watching the video, and every time, because it's just, yeah, as you say, it's so powerful to actually see the real life version. It's all well presenting the stats and presenting the methodologies, but I always like to present the real life application of what it is. And, you know, what we're doing is trying to make this translational. You know, we want to make sure that the research actually gets out there and becomes something that is being utilized and not just a publication in a fancy journal. So that's sort of where we would like to bridge the gap, definitely.
Yeah, and we have some great questions from the audience coming in, but and I'm going to get to them very soon, but I have a couple questions of my own. First, do you have any idea of what the hypothetical or theoretical mechanism of action for this type of therapy to completely eliminate the voices may be?
I think, you know, it's based on this kind of idea where patients often would report that they have this feeling of helplessness and they have no control over the voice. And this is finally a way for them to get control in a safe, simulated environment. You know, the whole time they are there with the therapist. And, you know, there's this kind of fear and the kind of ethical considerations in the beginning of, okay, is it safe to put patients who have this obscure idea of a reality in a virtual reality? But actually we've seen, and from the evidence, it's shown that because it's in this real life simulation and they're able to work together with a therapist and stand up to the voice, that is actually what helps them and why they believe that this works, because they can test it. The patient knows that it's an avatar, but at the time they are able to step out of their comfort zone and be more confronting, whereas because they have this sort of visual idea of what the voice looks like and it's not just imaginary, and you know, they're able to physically see it. And yeah, so I think it's a lot about gaining control over the voice, and that is what shifts the lack of helplessness and builds their self-esteem, and that's what a lot of the therapy is focused on. And like I said, you know, the therapy in the actual VR session is usually about 5 to 15 minutes. So there's a lot of work that goes around, you know, creating statements during the therapy and what we're going to say, how you're going to say it to them, and yeah, a lot of back and forth with the patient. And I think it's a lot of that helps build the patient's self-esteem, which is crucial to this kind of work.
Yeah,
I think another part of it is also that we talk a lot about it is externalization. This ability to make something that is, you know, intangible suddenly be tangible, and you can share it with family, and it kind of gets, you know, some sort of you know, it's more, the more tangible it is, the more it's easier to, or not easy, but the more you can handle it. And I think externalization is also another part of the mechanisms.
How often do you think the therapy has to be repeated for the symptoms to do not come back?
At the moment, they're testing it in 7 sessions over 12 weeks. And what they've seen so far, and that's kind of based on earlier research, and they've seen that after 6 months, up until 6 months, for some patients, they didn't hear any voices. But, you know, again, voices can come back, and they do come back, but it's about the strategies. that they've learned throughout the session. So that this is where the kind of the booster sessions come in. So rather than having another 7 sessions, it's about coming back and going back into the VR and try and working again with the voice. So at the moment they do offer additional booster sessions if required. But again, we don't have a long-term study yet, so a longitudinal study. So I can't give you a full answer, but yeah. And the miraculous thing is that for some patients, the voices completely go, and for other patients, it doesn't. So again, there's a lot of mechanisms out there that we don't know, and we still want to explore. And we've actually been talking about, a future study looking at sort of the neural mechanisms, doing brain scans and looking at the difference between patients who do really well versus those who don't. And is there something else that's going on? So there's so much to explore still. This is very exploratory. We're still at the very early phases, but the early phases are looking good. And we want to just make sure that we can make it better. And so it's still early days. Yeah.
That's fantastic. Thank you. I have a million other questions, but I see a lot of questions coming from the audience, so we'll go to those. Okay. So the first question is by Roman Kopalov. Does the patient create their own avatar in the program or just give instructions to the therapist nearby? I can imagine deeper emotional connection with the avatar if patient does it on its own, but did you research this topic?
At the moment, it's kind of done in collaboration with the therapist. So they will sit together next to each other and work together with the therapist. And that's mainly because of safety, and it's part of the therapeutic process actually to put together. And we know that a lot of the patients find it very difficult to see this voice and see this face. So doing it alone would be probably a bit risky, I think, personally, but it hasn't been tested. But yeah, so, and that's actually the difference between a lot of our technology, where it's very person-centered, where they choose. It's not like they're choosing from a list of avatars. They actually are able to create, and as you can see when I showed with the toggles, it's quite sensitive, so you can change it quite a lot. But yeah, to answer the question, no, they do it together with the therapist.
And how close do you think you can get the avatar and the voice to the patient's actual experience?
Yeah, surprisingly, I asked the same question to the therapist, and they said surprisingly it's quite accurate, even though the face doesn't look so human. I guess there's so much more work that's been done and really humanizing these avatar faces now that look just like people. But yeah, as close as possible. And the patient actually says, yes, this is as close as I can feel, looks like the voice that I hear. I think it's because we have so many different, some people will say their voice is more demonic. So of course it has a red face, or some people will say it's more human face, and or someone that they know. So they're able to do it as close as possible. So we haven't had many issues in that respect yet that we know of.
Okay, great. The next question from Fagar Abdul Rahman. Is there a manual for the therapy protocol in the VR-aided therapeutic journey to guide psychologists? I would say that the quality of dialogue and the gradual progression of the dialogue between the therapist and client is key. Please correct me.
Yeah, there is. The therapists do use a manual. And again, this was developed from the early researchers. So kind of Julian Leff's team and Thomas Craig's team back in the UK. And kind of modified to the Danish sample, I guess. And that's what we would want to do going forward, that it's kind of like a guideline that they have, the therapy guidelines. And when it's tested in different countries, of course, each country can modify it to suit their culture, to suit their country specific, more related to their patient groups. So yes, there is a therapy manual, of course, because especially when we're looking at conducting these trials, we try to keep it as standardized as possible. But of course, in a clinical study, it is applicable to be kind of changed to suit the patients and the country, of course, because schizophrenia and hearing voices is very different across the globe, of how they experience voices and the cultural differences as well. So of course, it's adapted to suit the cultures.
Yeah, and I'm sure as the therapists gain more skills over time, they'll get better and better at this.
Exactly.
This technology just has even more potential than what you're seeing now.
Exactly. Yeah.
And this question comes to us from Ray. Would this be considered a treatment that would need to be okayed by the FDA in the US?
Yes, it is. It is actually considered as a medical device, and there's so many new regulations here. That's why we have just certified it in Europe at the moment in the CE classification. We say that it's a software that aids a therapist. So it's not used as a diagnostic. It's a tool for therapists to use. So there's no kind of risk from using the software. It's all on kind of the therapist. It's like I say, it's just a tool that they can use to help them with the therapy. But yes, it would need to have FDA approval.
But of course, for clinical trials, we can get an ethical approval.
Yes.
So realistically, for the next couple of years in the US, we will be doing mostly clinical trials rather than imagining selling it.
Yes.
So it has to be ethically approved by an ethical committee.
Thank you. And another question from Roger. Congratulations for your work and thank you for sharing with us. How does your clinical project compare with the work of Dr. Alexander Dumais in Montreal on the use of VR and schizophrenia? Of course, Dr. Alexander was famous for doing avatar therapy early on.
We've been following. We've been following the research there. Of course, we've been looking at what they're doing. And of course, we don't have in-depth knowledge of what they're doing. I think part of the big thing that we can provide, that we're providing, is of course the amount of patients, 266 patients, which is a lot more, I think, than what they were doing in Canada. And then I think the fact that we're a studio with 40 people behind it is also something that we can see that we can potentially scale in and get it out to millions of people over time, which is also, I think, a little bit different than what I've been reading about their approach.
Yeah, thank you. And Roman also asks, do you have any plans to integrate generative AI for voice or responses generation? If so, how do you see this? Yeah, of course, generative AI is the big hype of today.
Maybe I can answer. So I think the generative AIs there's a lot of different perspectives on AI in general. We have a PhD student working for the next 3 years on using artificial intelligence to improve the voice modulation part, so we can get even closer to replicating a natural voice, and that we can pull it much more dynamically than we can currently in the software, and remove any of the metallic things that you get in this real-time voice modulation. So that's an AI PhD that's working with us now. I think on the avatar side, I don't think necessarily you need an AI to improve the avatar system. We have we get a pretty good feedback from patients on the current avatar system, but of course, adding facial expressions, adding all these things are definitely things that can make it better. We did do an experimental trial with a small patient group as a part of this trial with facial feature, emotions, facial emotions, and I think that also has some potential.
Great. Yeah, the next question comes from Hunter McCann. Do you have a module for autism?
No, we do not. But again, like we say, we're very open to new areas, as I mentioned earlier. So yeah, we're open to new ideas and how this can be applied. We're not experts in every single area, so of course we welcome the expertise of how we think, how people think that this can be applied.
Yeah, it would be really interesting to. We've had a lot of dialogues, earlier on in outside of avatar therapy, but where autism and playground simulation. So where we talk with the different researchers about using virtual reality in a way of doing a play simulation for autistic children as a kind of training. But of course, it could be interesting to apply the avatar method in other areas. So if the guy who asked the question is an expert in autism, we would definitely be interested in having a meeting to see if there's a potential there.
Great. And the next question comes to us from Ritwik. How does VR help in comforting the patients and in turn help them to treat their illness? How do people get attached to these avatars?
I think they work, like I say, they work very closely with the therapist, and they create statements before they go into the therapy. So together with the therapist, they will say, okay, what do you want to say to the avatar? How are we going to react with it? You know, how are we going to communicate, etc. So and the therapist, the patient knows that the therapist is the avatar, but there's something about it that they are able to still have this relationship. And again, it's about building the confidence. And even in the case study that I presented, it was hard when he even heard the voice straight away. He was already, the anxiety was so high. So I think it's a gradual exposure over time in the sessions that builds their confidence very slowly, and then they become able to build this good relationship. Another key thing that they do in the therapy is that they receive statements from family and relatives that they can then also bring into the session, and they get the avatar to say those things. So it's kind of nice things about the patient. It kind of flips the script in terms of what the avatar is normally saying, and the patient experiences the avatar saying nice things. So again, that also is something that is different, and helps build a positive relationship with the avatar. So it's about kind of flipping from going from a malevolent voice to a more positive voice for them, and that helps them in terms of coping with the voice better.
And next question is, how do you explain coupling the avatar by featuring it as the negative and maybe aggressive voices in their head with the therapist himself and the effectiveness of his role?
I don't really understand the question, sorry.
Yeah, it's I'm going to reframe it. I don't know if that was meant, but the voice, if the voice is normally very negative, the therapist assumes a completely different personality to the voice in the avatar, because the therapist is supportive and calming. That like the realism for the patient, that does it, bring the immersiveness nature of the experience.
So the therapist will actually begin by saying the commands that the voices say. So they will start with the negative voices. And it's really interesting when we speak to the therapist that they say that they find that the most difficult part of the therapy, because they have to say horrible things to the patient, even though it's through being an avatar. So they do start off with that. But of course, then, because the beauty of the software is that, by flip of a button, then the therapist becomes a therapist. So then they would say, okay, the avatar is gone, and then the therapist is there to say, okay, now it's me talking. Okay, how did you feel? What can we say back to the avatar? And then, that's what's really lovely about the therapy, is that, you can switch back and forth between being the therapist and being the avatar, which keeps kind of the reality of it in terms of, okay, the patient is safe and they know that, okay, this voice is the therapist, but I am able to stand up to it, etc. So yeah, and also another beauty of the therapy is that the patient is in the room with the therapist at the same time. And a lot of the other studies out there involve having to be in two clinical rooms separate. And actually, we believe that being able to be in the same room during the VR therapy is very important, again, for for the safety of the patient, but also for the confidence of the patient to be able to, when they're ready to stop, they can stop, and they know that the therapist is there to comfort them if they need it. So I hope that answered the question, but yeah.
If not, the person who asked, please ask.
Great. I saw a thumbs up, so I'm hoping that was the person who.
And Jose Ferrer Costa asks, did you get many patients discontinuing the VR therapy for any discomfort related to the headset or the use of VR itself?
As far as I know, we haven't had any reports on sort of severe outcomes in terms of that, to be honest. As far as I know, right, Simon?
I think
we kind of ask them a lot.
There hasn't been a lot. I think there's a lot of fear for the patient, not so much about the VR, but to meet the avatar in the beginning. So we've had a few, not a lot, but a few that dropped out in the early sessions because this meeting is very scary. But the VR part is in itself very calm, and also there's no movement. You know, you're not moving the body, so the cyber sickness is not so severe. So definitely the biggest dropouts have been the early meeting in the beginning sessions, but this hasn't been, but it's not a lot.
Okay, thank you. And Jose also asks if you have any experience in a Latin country like Spain.
Not yet, but we are in talks, and if Jose is interested in also wanting to do a trial, and then we're very open to expand. But we are in talks with a few people in Spain at the moment. And
then Ray asks, are therapists in the experience in the VR, or are they watching from a screen? And is there a difference in your estimation for that?
No, they're involved in the whole experience. Like I mentioned earlier, the therapist is kind of flipping between being the voice to being the therapist. So yeah, they're in the experience the whole time.
So
But
is
of course the
VR
therapist, yeah,
Sorry.
they're not wearing a VR headset. Sorry.
No, sorry, no,
Yeah.
they're not. They're in a
So the therapist will be sitting with a microphone and looking at a screen with a dashboard of how to control what the patient is viewing. And so, and there's no avatar created that looks like the therapist.
No, yeah.
So, but of course they're controlling the whole, everything that happens inside the VR, but from a screen.
Yeah. So in the real world, the patient sees the therapist, but not the voice. And in the VR world, they see the voice, but not the therapist.
Yes.
That's right.
Got it. Isabel asks, did you get many patients discontinuing the VR therapy for any discomfort related to the headset or use of VR itself? I think you answered that already, that no.
Yeah.
Next question comes from James Liu. This is a very interesting and innovative application of VR. What VR devices are supported currently and will be supported in the future?
So I think we try to build it hardware agnostic, so that we don't focus too much on a single platform or too tied to any. Right now we're using, in the beginning we were using the Oculus Rift S. Now we're using the Oculus Quest 2, but we're built based on Unity and OpenXR, and so if a better headset would come out, we could start using that right away.
Great. And James Liu also asks, I understand that the initial therapy sessions need to be conducted and facilitated by trained professionals. Would it be possible or feasible to have self-service therapy sessions after the patient is evaluated and determined by a professional to be in a stable mental state that could be eligible for self-service session?
I think, yeah, at the moment, it's like I say, it's too in the early phases to suggest that. Even in terms of the training of therapists who administer the avatar therapy, they recommend that it's the therapists who have experience with patients with psychosis, who have experience with patients with working with patients with schizophrenia. So at the moment, we're at the stage where we're trying to be as risk averse as possible, because it's still very early days. Maybe in 5-10 years time, it might be different when we have a lot of clinical evidence. And but at the moment, I think we're just making sure that we get the good clinical data to support this version and this protocol. And then later on, we will look into different ways of course, that would be great to be able to do that. But yeah, we all know how high risk this patient group is. So at this early stage, we wouldn't recommend it right now.
I'm wondering how it would work, because right now the therapist has to speak for the avatar. Would it? But I can imagine like telepsychiatry remotely speaking, because they're speaking into the headset. Supposedly that can be done from anywhere in the world as long as they have an internet connection. Yeah,
and I guess we have the Australia trial, Simon, that maybe you want to share with how that works. That's probably the closest thing that we're doing. That it's a remote version, but the patient doesn't have a headset. But yeah, maybe Simon, you want to
So in
share
Australia,
that?
we're doing a trial with using Zoom, because the distances in Australia is so great, and there's a lot of people that live outside range to a psychiatric hospital. So in Australia, we're doing a non-VR Zoom version where you meet your avatar in Zoom together with some experts in telepsychiatry and schizophrenia. And I think so that's really interesting to see how that will go. That trial is starting this month or next month, and we'll go for the next couple of years.
Yeah, I would be very curious to know how 2D versus VR compare to each other. Do they have the same effect, or is VR superior to the 2D?
We of course we don't know at all yet, but in my mind, I think VR is superior because the immersive power really, you can just see it in some of the documentary and the patients. But then again, remote has another advantage, which is that someone is sitting maybe 4 or 8 hours from a psychiatric hospital, and the only way that you could do something like this would be remote. So I think so there's pros and cons with each approach.
Sure. Maybe in the future we can see some head-to-head studies, 2D versus VR.
That
That'd be
really
super interesting. Yeah.
Yeah. Or a combination is also a really interesting idea.
Yeah. So we don't have any more questions from the audience. I have one last question for me. Actually, we just got another question. From Roger, do you envision the day where VR would be compared to drugs?
Yeah, well, I think some of the things that's happening, at least in Europe, is when, especially in Germany, has gotten a lot of publicity about how, prescribing VR or not necessarily VR, but digital therapeutics is a thing that's prescribed and a thing that's reimbursed, similar to how drugs are or other treatment. So I think that is definitely a direction that is we're going in, is that digital therapeutics are on the same playing field as other treatment in terms of reimbursement and treatment. So I think that is definitely the direction.
I would say VR is already compared to drugs, for example, for pain control. There are a number of studies about that showing VR to be as good or better. And so I imagine here that, it would be great to expand it to other things like schizophrenia, where especially the drugs have a lot of side effects that the patients don't like. And a lot of my patients, when I ask them about the voices, they say that they hear demons, and sometimes they hear like 1,000 voices. Sometimes they can't really explain what the voice sounds like exactly. Have you come across a lot of that? It sounds like that would be hard to create an avatar for many patients like that.
Yeah, I think it's actually rare for patients to just hear one voice, and actually they have lots of voices. But for this trial, we asked them to focus on the most dominant voice, because at this stage, we can't have 5 different avatars at the same time. I think it'd be more confusing and distressing. So yes, I agree. A lot of our patients as well, speaking to the therapists, say that they do have more than one voice, but kind of they focus on the most dominant in the therapy.
Yeah.
And they cannot choose a voice. It's a part of the exclusion criteria. If they're unable to choose a voice, everything, then this therapy probably, in the current form at least, will not help them.
Yeah. Okay. So that's all the questions we have. So thank you so much. This was very insightful. I can't wait to see the results in 2024.
Yes, we'll be back to present them, hopefully.
Well, I can't wait to read it. So thank you so much. And Steve, you want to come back?
Yeah, well, I think this is one of the best talks we've had in the 2 years we've been providing them, because we have richness on every axis of the complicated path of building a medical XR innovative application. We have the historical work done by Leff and Craig and in England on using avatars, and some of their students are now in Denmark and working on this clinical trial, followed by work done from in the University of Copenhagen to develop the protocol. And then we have an XR studio with Khora that is purpose-built to in terms of the talents and the studio capabilities, both hardware and people, to build high quality XR applications. And last but not least is having Farah, who's a domain expert in the field of clinical psychology, to lead the team that is working with the people running the clinical trials. And I'm incredibly impressed by that, and it's a hard problem that if the result is reduced drug use by the patients to treat them, it hopefully will be a very, very successful trial. So I want to thank our speakers, Simon and Farah. That was a fantastic talk. I think it'll become part of the curriculum on how to, which is good. And Omer, I really thank you for joining us and moderating. Your insights and questions improved upon it. And one last thing, I saw Farah answer a couple of questions while she was talking, and on the chat. She was both presenting and typing, and you couldn't tell looking at her that she was doing two things at once.
I think that was Simon. I won't take credit for that.
I think I was typing.
But I should have gone with it.
Yeah. Well, wonderful. Well, thank you. We really appreciate it. This was a wonderful story about the journey of the medical XR innovator, and look forward to learning about the study when it's complete.
Thank you so much. Thanks for having us.
Yes.
Bye,
Thank you.
everyone. Thanks.
Bye.
Bye.
Bye.